Hi, I'm Dr. Jeffrey Anamorino. I'm a board-certified plastic surgeon from Bellissimo Plastic Surgery and Medi-Spa. Tonight, this will be our fourth live Facebook production, and I'm very pleased to announce that we just purchased a laser, and so we've added a laser therapy to our Medi-Spa treatment program. So tonight, we're going to dedicate the entire next half an hour or so talking about laser therapy. So if anybody has any questions, please interact with us on Facebook. I'd be happy to answer any questions. And as always, I'm going to turn the questions over to my wife, Ella, and please interact.
So to begin with, what exactly is laser therapy?
Common question because lasers have this kind of aura about them, but laser therapy is actually the use of a laser in a non-invasive way to treat certain skin conditions and also damaged tissue. So with the laser that we purchased, we have an Aerolase Light Pod Neo, which is kind of a cool name, but it's a great laser that came out on the market a few years ago, and it treats a lot of different things, a lot of different skin types, and we'll get into that a little bit later. But we purchased that after a long sort of a vetting process. We've actually been looking at lasers for 2 years, and I've looked at lots of different lasers. I've talked to lots of colleagues. We have done different demonstrations from different lasers, tried it out on friends and family and our own staff, and this is the laser that I thought was the best that suited our practice. So we're going to get into what it treats, how it treats it, and why we're excited about it.
Who performs the laser treatments at Bellissimo?
So here at Bellissimo, I have a fully licensed esthetician that most of you know is Tara, and she's terrific. I also have a registered nurse that does, up until now, does all of my injections as far as dermal fillers, Botox, and now she is doing some of our lasering as well, and that's Pamela.
Why would you get laser treatments at a Medi-Spa versus elsewhere?
You know, this is an important question. There's a big difference between Medi-Spas and just regular spas out in town. In our practice, my Medi-Spa is under my direct supervision and care. So I have two people that I've employed that are fully licensed, have experience, and not only that, but now they have been trained by the company. They're fully trained to use the laser in all different aspects. The other thing that you get at a Medi-Spa is that under my supervision and with Tara and Pam that are healthcare providers, we will also talk to you about your past medical history, your allergies, the medications, anything that would interfere with your results from a laser. You're not going to get this in other types of spas that are not being conducted or overseen by a medical doctor.
What made you decide to bring laser technology to Bellissimo?
Well, since we opened our doors a little over 2 years ago, I thought this was the last piece of the puzzle that really makes our Medi-Spa whole. We wanted to be able to treat and provide service to all of our patients, and this was the last piece of technology, at least up to now, that would round out our practice so that when you come in, we have a whole array of skin products, facials, microdermabrasion, microblading, we have Botox, dermal fillers, and now we have a laser to treat all different skin types.
How exactly does laser technology work?
Lasers are interesting, and you think about a laser really is just a very concentrated beam of light. And in this case, it's a 1064 nanometer wavelength. And so what this wavelength does is it comes out, it's pure, it's only that wavelength. Light outside coming from the sun has all different types of wavelengths. This wavelength targets three things in the skin. One is water, another is blood, and the last is pigment called melanin. So with that, we can treat photosensitive skin that's been aging, pigments, hair reduction. We can treat rosacea, little capillary angiomas. We have little red spots on our cheeks and noses. We can treat some aging processes. We can also treat some bruising, again, pigmented spots. We can also treat scars and do some slight scar revisions with it. Sometimes we can treat port wine stains, which is basically a birthmark that most of you refer to. So all of these things that we can treat with this laser.
Why would I choose a laser treatment instead of another type of treatment, such as a Medi-Spa or surgical treatment?
Lasers are sort of an adjunct to a lot of the other things that we do. So we can combine them with other processes. If somebody comes to me and they were talking about a facial rejuvenation and they're really a good candidate for a facelift and eyelid surgery, I would do that surgery, and then on top of that, the laser would help really condition the skin even further, tone up the skin, take care of the same things, that the pigments that won't be treated with surgery, fine lines, textures of the skin that surgery doesn't treat. Tara can use the laser and also do a light peel afterwards to help with the exfoliation. So the laser is part of the treatment process. It's not a single treatment. It's just in a continuum of things that we can do to help people reach their goals.
How does permanent hair reduction work?
Hair reduction is an interesting process. When you have the life cycle of a hair is actually in different stages. You have a couple of growth phases and you have a dormant phase. To treat hair so that you reduce the amount of hair you have, you actually have to target it or hit it with the laser during one of the growth phases. So what ends up happening is the darker and the coarser the hair, the better the treatment. If you have peach fuzz or white hair or gray hair, it doesn't work very well because, again, remember that wavelength of light picks up on the pigment. So if you have a dark hair, that beam of light targets the melanin in the hair. It heats up the shaft. The heat from the shaft now damages and kills off the hair follicle and now prevents the hair follicle from producing any more hair. To do that, it does take anywhere from 4 to 6 treatments, about 6 weeks apart, because again, hair is moving in and out of those phases and we want to try to catch them in its growth phase.
What about the skin rejuvenation and tightening? How exactly does that work?
Well, one of the things that I talked about before is that wavelength of light also targets water. So in the outer part of the skin, the water that's in the cells, when the cells are getting old, the laser will target that, and now some of the older cells that are causing texture problems will now be exfoliated or just removed. It will then penetrate deeper into the dermis. So that's the deeper part of the skin. That's where the elastic principle properties are. That's where the hair follicles are. So what it does is it can go down into the dermis and target the water there, so you get a little bit of an evaporation, which causes sort of a shrink wrap effect, so that it tightens the dermis. It also causes some thermal damage to the dermis, and that also helps spark the dermis to actually thicken and become a little bit more rejuvenated. So in 2 different ways, it can help shrink wrap the skin.
Are laser treatments safe for all skin types?
Be careful when you're going out for laser treatments. Not all lasers treat all skin types. There's about 6 different skin types, from very fair complected to dark skin. So the nice thing about our laser, it has the technology that it can treat all 6 skin types. We change the wave or the heat or the energy of the laser depending upon the skin type, but it is safe for all skin types. It's one of the only lasers that can do that.
Who is the best candidate for a laser treatment?
You know, anybody that has any of the problems that I talked about, so we can treat even young teenagers, 13, 14, 15-year-olds that are now getting some acne. As long as it's not active acne, if you just have sort of in its dormant state, you can treat it. You can treat anybody older than that, anywhere up to 60s, 70s, 80s. So we can treat sun damage, fine lines, all of that, all along that spectrum. Anybody with a skin problem can probably at least be seen to be treated with the laser.
Who should not be treated with the laser?
Patients that should not be. Anybody who's pregnant, anybody that has an inflammatory process or an infection on their skin should not be treated. Patients that have, as I said, it can treat all different skin types, but somebody who has an active sunburn should not be treated. And you probably should have watched our last video about sunscreen, but those patients should not be treated. Patients that have an autoimmune disease like lupus that has a skin component. Not all lupus patients have a skin component, but if you're one of those patients, you should not be treated with a laser. Anybody who has had bad scarring with a laser should not be treated with a laser. And that's about it.
Is a consultation required prior to the treatment?
Of course, again, that's one of the things about a Medi-Spa. I would require everybody to be seen by either myself, Tara, or Pam. You can be treated on the same day or at another time. But again, we need to assess what your expectations and goals are. We want to know what you want to treat, what kind of remedies you've tried in the past. We need to know what your past medical history is. We need to know what your allergies are. We need to know what your medications are so that we don't have any type of interference. Kids that are underage, so we talked about the teenagers that are under 18, I require the parents to be part of that consultation, and that we do require them to sign the consent for the patient.
Is there post-treatment care?
Nice thing about this laser, there's not a lot of post-care. There's not a lot of downtime, so in fact there's really none. Once you get treated, it's usually about a 30-minute procedure. Sometimes it takes a little bit longer, but the average is about 30 minutes. You actually leave the office with a slight glow. You might have a slight redness for the first couple of days. You might have a little bit of scabbing if we target some pigmented cells or some acne scars. You might have a little bit of scabbing for the first few days. You might feel a little warm for the first couple of hours, but there's really no downtime. You can go out and do anything you want after that. Your skin will be photosensitive for the first several days, so we do recommend sunscreen, and we actually apply it after you get your treatment here. We actually apply the sunscreen so that you can go right outside.
How quickly will I see results?
That's a good question, because that's one of the most common questions that people ask. It depends on what you're being treated for. As I said, if you're doing hair reduction, you may not see it for the first couple of treatments, and it might take, I said, 4 to 6 treatments. You'll see some, but to really get the full effect, it'll probably be after your 5th or 6th treatment. If you're coming in for pigment changes, you can see some lightening of the pigment almost right away. But I warn you also that if your pigment can also go the other way for the first few days, where actually an area that you're being treated like melasma, so a lady who's been pregnant getting a hormone-induced pigment, you can actually get darker for the next couple of days, and then it will lighten up. If you have a little bit of scabbing, it will fall off over the next few days. The only thing we would have you do is use a very gentle cleanser on the area, and again, the sunscreen.
Do you need more than one treatment then for best results?
Just about everything we talked about will need more than one treatment. The average is about 3. Like the photofacials, rejuvenating the skin takes about 3 and about 4 to 6 weeks apart. Hair is usually the longest, usually 4 to 6 treatments, about 6 weeks apart.
Does the treatment hurt?
No, and for any guys listening, I've had the treatment. It feels warm, but it doesn't hurt. Afterwards, the heat goes away pretty quickly, so there's really no after effect to it as well.
Any risks?
The nice thing about a laser, the risks are very small. As we talked about, as long as you're not one of the people that we talked about as being contraindicated, your risk should be very minor. The nice thing about it, we know that it's going to take several sessions. So the first session is really just kind of see how you do. We can turn down the energy of the laser at the beginning, treat you very conservatively, and then the next time, each time we do it, we can turn up the energy and get a slightly better result. So we can kind of tailor this to everybody and to what your ability is to tolerate the heat and also what you're being treated for. So plan on several treatments, but the nice thing about the laser, again, is it gives us such good control. If you have like a heavy peel that some people are getting in the operating room or under sedation, you're just sort of painting this chemical on and you're hoping that it's at a certain depth it's going to be eliminated. With the laser, we can actually control what depth we get to each time we make a pass, and that in the broader sense leads to better results and less risk to the patient.
Can you combine this then, the laser treatment, with other spa procedures? I believe you mentioned something about peels.
Yeah, so the nice thing again about this laser, you can combine them. The most common things we combine them with are Botox and dermal fillers. So if you're coming in, you can do both of those on the same day. We recommend doing the laser first, and then immediately after you can do Botox and you can do dermal fillers. If you've just had those procedures, the dermal filler and the Botox, and then you decide you want to do a laser, we ask you to wait about 2 weeks after the dermal filler and Botox before you get the laser treatment. What Tara is actually doing now, which works very well, is she's doing the laser treatments and then immediately afterwards doing a very light peel. And what we found is the texture improves much quicker, and it also exfoliates all that dead tissue, all that dead skin on the top that's going to flake off over the next few days. You can get rid of it much faster if you undergo a light peel.
You kind of answered my next question. Can men use the laser treatments as well?
Yeah, again, it's for anybody. So men, women, young adults, and some teenagers. The most common thing men come in for is hair reduction and skin texture. So getting rid of pigments, kind of tuning up the skin a little bit. Men are taking better care of their skin over the last 5 to 10 years and kind of catching up to women in that sense. The nice thing about this is you can kind of come in, again, there's no downtime, you can get it done, no one knows you've had it done, and you can go right back to work, or you can go right back out and work out that evening without any downtime.
Can you explain to someone how they would go about beginning this treatment?
The first thing is you would just call the office. So you can either go through the website, www.bellissimoplasticsurgery.com. You can call the office. Again, we would require you to come in, go through a consultation. It doesn't take that long, probably 15 or 20 minutes to go through everything, and then go through the treatment process. If you want to come in and just do the consultation, see if you're a candidate, talk about it, and schedule it another time, you can do that as well.
What qualifications should someone performing the laser treatment have? Would I ask that when I come in for my consultation, or?
Good question. We always tout credentials. I think that, again, you have to be in a place. I would recommend, if you're going to do laser treatment, I would recommend you being in a med-spa, so that's being overseen by a doctor. The people that are doing it are licensed, either laser technicians, licensed estheticians, nurses, nurse practitioners, physician assistants, or even MDs.
What locations will you be offering this laser treatment at?
I know I keep saying there's a great thing about this laser, but one of the things we were looking for in a laser is that it was portable. This laser can be taken to our different locations. So for the time being, we're going to have it based in Shadyside and in Monroeville.
And when will you begin booking these laser treatments?
We are right now starting to take appointments for August 28th, so at the end of the month we'll be wide open, and people are already starting to book those appointments now, so we're excited about it. We will have specials coming out in our newsletter that will be out at the end of the month or early September, and we'll have some nice discounts on lasers and packages that you can look at for the next few months.
Will you be posting any before and after photos?
Absolutely.
What areas of the body does permanent hair removal target?
It can be any area on the body. There are some guys that are taking care of parts of their beard. Women, it can be bikini lines, chins, mustaches, underarms, and legs. So these are all areas that are targeted. Anywhere where there's dark hair, and again, the darker, coarser hair works best.
Are the laser consultations complimentary?
Yes, they are.
Can you compare skin rejuvenation to a facelift?
Again, I guess the thing that differentiates a facelift and skin rejuvenation, a facelift rejuvenates the look of the face. It's not going to rejuvenate the skin. So if we're looking at changing the texture of your skin, the pigment of your skin, then the laser therapy will be the better choice. If you're looking at changes in the skin due to aging, where you're starting to get some deepening of the folds, you're losing some fullness around the cheeks, you're starting to get jowling in here, your neck's starting to get a little lax, then there's nothing that's going to work better than surgery. And as I said before, the best thing is we would combine those so that you get the best of both worlds. Treating your skin will help you get better longevity out of your surgical facelift. So we would do the facelift and then add the laser and skincare afterwards. You can actually even start the laser even before the facelift.
What would you say is the best part about this Aerolace laser? What drew you to this laser specifically?
You know what I liked about it was a number of things. I've touched on all of them, but let me just sort of sum it up. I was looking for a laser that gave us good versatility. That means I can treat lots of different patients, lots of skin types, lots of different problems in the skin. And this laser crosses the board. It has some technology where other lasers don't. Other lasers, when you talk about laser, it's the length of the pulse. This pulse length is very short, so it can deliver a little bit higher energy to a very specific area, so you get better results that way. When the pulse length is a little bit longer, the heat can dissipate and you don't get the same effect, so other lasers aren't as effective. This laser is very versatile, treats many different skin types, as I said. It's portable, and for us, it just fits our practice better than the other ones that we looked at. There's lots of good lasers out on the market, but this was the one that fit our needs.
No further questions, doctor.
All right, well, listen, thank you for anybody who's tuned in. If you have any further questions, you can contact us through the website is one of the ways to do it, www.bellissimoplasticsurgery.com. You can also call the office for consultation or any questions that you have. Again, thank you for tuning in, and we should have another one ready for you maybe next month.